But really quickly before I begin, I just wanted to give you background on me and how I got here today. I spent years in primary care, and I can remember coming home from work and putting my head down and complaining to my husband, I am part of the problem. I am essentially a drug dealer, and that's how I felt. And then I got salvation from my other employer, which is IU Health, who asked me, would you be willing to start an obesity program for us? And I jumped at that opportunity. And as I founded the program and looked into various options on what we were going to do, I discovered carbohydrate restriction. And although we started out as an obesity program, quickly the focus changed to something that I think is much more important, which is we were seeing patients' diabetes going away. And at that point, I went from being a straight-up clinician to jumping into research because I wanted to help put this on the map as the way that we handle type 2 diabetes. And I met up with Verta Health, who sponsored the large clinical trial that we're going to discuss today. And the idea here is scaling this treatment. So with that, wait a minute. See if I can figure this out here. Let's see. Oh, I'm doing it. It's just not changing here. Sorry about that. Okay, so question first is, why are we here? And then we're going to talk a little bit about type 2 diabetes, and I realize that we have a mixed audience here, so we're going to just talk about some general physiology so you can understand why this concept works. We're going to talk about how Verta reverses type 2 diabetes and what a day in the life on Verta for a patient looks like, and then end with discussing a new paradigm for this disease. So Verta's mission is simple. We are going for reversing type 2 diabetes in 100 million people by the year 2025. And although initially that seems like, wow, that is amazing and impossible, I would challenge you after today to say, I think actually that our goal here is in reach. So the question that we really started off with is this one. Can we use nutrition science and technology to solve one of the most pressing health issues of our time? And I hope to be able to convince you today that this is something we can do and are doing. So type 2 diabetes, let's talk about this. First, let me ask this question to the audience. Do you have type 2 diabetes? Or do you know someone in your life who's struggling with this disease? It's so common now that the answer is probably almost 100%. People would agree. I either have it or know someone who's struggling with it. And struggling and getting frustrated because they're doing what they're supposed to be doing, and yet the disease continues to progress and get worse. The numbers on this are staggering. 4 in 10 adults now have prediabetes in this country, and 1 in 7 have type 2 diabetes. That's over 50% of the adults in this country. That is an amazing number, and it's continuing to get worse. And let's talk about our standard management of this. The American Diabetes Association says that this is chronic and irreversible, and a study done at Kaiser Permanente showed a 0.1% diabetes remission rate. And I'll tell you that I flatly reject these if we approach this disease differently. So Verta, we are in the business of reversing type 2 diabetes, not, as our standard of care is, just managing it. So what does this mean for patients? We are a lifestyle-based intervention that is utilizing carbohydrate restriction and technology to help people in their lives on their schedule. And does it work? So again, we're currently 1 year into a 2-year trial, the largest and longest ever done on carbohydrate restriction as a treatment for type 2 diabetes. And after 10 weeks, 56% of the patients in our trial had reduced their A1C, which is a measure of blood sugar control, below the diabetic threshold in 70 days, 10 weeks. So how did we get here to this problem that is impacting over 50% of the adults in this country? I mean, our standard treatment, we do need to review that, is to take more medicine, oftentimes causes weight gain in patients, which increases expense, and we're constantly telling them to eat less, and oh yes, as you're eating less, I want you to exercise more. Let's think about that for a minute. So let's go back to some of the basic nutrition science, and here's the fact. There are 3 macronutrients in our foods. There's actually a 4th macronutrient, which is alcohol, but that's not gonna be the focus here. So all the food you eat, later maybe, all the food you eat is a carbohydrate, a protein, or a fat. And the fact is, when it comes to blood sugar, okay, what's the problem with type 2 diabetes? The problem with type 2 diabetes is that they have elevated blood sugar. And when we go back to what our food is made up of, carbohydrates, proteins, or fats, we find that they have very different effects on blood sugar. And when we eat carbohydrates, our blood sugar goes up. In fact, the American Diabetes Nutrition Guideline says carbohydrate intake is the single biggest predictor of glycemic control. Okay? So we need to focus on that. Proteins, we have a blood sugar rise, especially in late diabetes, a little bit. But notice what happens with fat. It's essentially nothing. And this is why fat is actually going to be an important part of a science-based nutrition recommendation for this disease. Now, what about before blood sugar rises? Because you don't go from being perfectly healthy to having type 2 diabetes the next day. What happens for years or even decades is we have elevated levels of insulin. And in fact, some newer research will tell us that it's actually the elevated level of insulin itself that causes something called insulin resistance, which we're going to talk about briefly. But when we look here at the insulin response to these macronutrients, the things we eat, we find the exact same pattern. The carbohydrates not only cause the blood sugar to go up, but they cause the insulin to go up. The step 1, if you will, to developing type 2 diabetes. And when I explain this to patients, what I like to say with insulin resistance is think of insulin resistance as a key for a lock, but the key doesn't fit. So insulin is our fat storage hormone. And that's key. So when our insulin levels rise, our body is in like a lockdown storage mode. We want to take what's coming in and store as much of it as we can. Now, again, understanding insulin resistance. This is what I like to ask my patients. How much sugar's in your blood? And most of our patients realize that a blood sugar under 100 is a normal blood sugar. But what does that really mean? I mean, under 100 what? Let's put it in some terms that we can understand. Because if you actually do the math on this, realizing that the average person has about 5 liters of blood running in their circulation, what you find is that there's 5 grams of sugar in all that blood, which is a teaspoon. So all the blood in our circulation, there's blood sugar in it, but it's less than most people think. It's actually only a teaspoon. So what happens then when you eat? Let's think of a good classic low-fat food that we might be recommending to our patients with diabetes, a cup of brown rice, which might seem like a good choice for 2 reasons. Reason number 1 is it's low-fat. Reason number 2, it's low-cal. It's actually got less than 200 calories in it. The problem is almost all of those calories are carbohydrate calories, which means that it's got about 45 grams or 9 teaspoons of sugar coming into a system in pretty short order that's only got a teaspoon running through it. And we know that we can't just have our blood sugar go up that much because we'd go into a diabetic coma and die. And that's not what happens every time we eat. So what does a system do with this scenario? Well, if a system is functioning normally, what happens when the rice starts to come in is that the insulin goes up, and insulin acts to open the doors to our cells and push sugar into them. Gets it out of the circulation so we can maintain that happy 1 teaspoon range and push the sugar into the cells where it can be used. But remember my first analogy with insulin resistance. Insulin resistance essentially means that the key doesn't fit. So we increase our insulin in response to this rice coming in, but it's not enough to clear the sugar. to push it into the cells because we're resistant to it. So our body, our backup plan, if you will, is to make more keys, flood the system with more and more insulin, and we have these rising levels of insulin acutely and chronically. And eventually, one key is going to fit, and we can push that sugar into the blood and maintain normal blood sugar levels. And that system's going to work for a long time, years, decades. But the problem is when someone's diagnosed with type 2 diabetes, on average, 50% of the cells that make insulin have died from overuse, from all these years of having to make these supraphysiologic levels. And so what we see is that in someone who has a high carbohydrate tolerance or not insulin resistant, we see when they consume something like the rice that we have a moderate insulin response. We have to have some insulin coming in with the rice coming in order to push it into the cells. But when someone is insulin resistant, we see an exaggerated insulin response, very exaggerated, lots of insulin, lots of our fat storage hormone being created in order to dispose of the rice and enter in the vicious cycle. So we eat carbs over tolerance. What happens is we release more insulin, we're less sensitive to insulin, and we need even more insulin. And around we go. So the standard of care is to increase insulin even more, which actually doesn't really make any sense from a basic science and physiology standpoint. We can indirectly reduce blood sugars, or we can again go back to that old eat less, exercise more approach. Oops. So let's go back and review the standard of care again. So standard of care, part 1, again, is to push people to lose weight, eat less, and exercise more. And, you know, this made press not too long ago, the Biggest Loser study. Does it work? Well, temporarily. But if you go back here and you take a look at some of the individual patients, what you see is that their metabolic rate has been severely affected. This fella, 800 fewer calories now burned per day than he would expect with that eat less and exercise more mentality. How about this guy? 458 fewer calories than would be expected. And this guy, he is now 516 fewer calories than would be expected. And that shouldn't really surprise us. Let's take a look at this Quebec twin study. Okay, so these people were brought into a hospital, identical twins, okay, 7 pairs of them. Brought in and fed enough calories to make no difference in their weight. Okay, so calories were all dependent on their basal metabolic rate, which was determined ahead of time. They were given enough calories to keep them weight stable, and then they were all instructed to exercise to burn 1,000 calories a day. It's a lot of exercise, 1,000 calories a day. And so what happened? Did they lose weight? Well, some of them did. Like the red circle group, right? Those twins should exercise for weight loss because it worked pretty darn brilliantly for them. But what if you were one of the other sets of twins? It didn't go so well because if you just look at this whole concept of calories in versus calories out, what we would expect people to lose is the dashed line at the bottom. And most sets of twins didn't get there. So they were eating something to keep their weight stable and exercising like crazy, and their weight was not changing like we would expect. And the other thing that was found is 3 years later, what happened if we approached it this way is that their metabolic rate went down. That is not helpful. Eating less and exercising more does not work as a weight loss strategy for most people. Let me tell you, I'm an exercise physiologist by training. That's what I have my master's degree in. I want everybody to exercise. But when we're telling someone who's struggling with diabetes, and most of those people are overweight or obese, telling them that their solution is to exercise when they're having difficulty getting across a room is punitive. We have to rethink this. So again, back to the standard of care. Remember, we're having a problem with too much insulin, right? High insulin levels. And so what do we do as our treatment? We give them more insulin? Again, we go back to that vicious cycle that doesn't make good sense. And we can see this in trials like the Accord trial. This was a big diabetes trial that said, what if we could get patients really well controlled by giving them more medicine? Will they do better in the long run? And the answer in a nutshell is heck no. In fact, the patients who were tightly controlled with more medicine gained more weight, and actually their mortality was worse. Tight control by use of more medicine actually backfires. And again, that shouldn't really surprise us because most of the patients in the Accord trial were on insulin. And if we think about a system where the root problem is these elevated insulin levels and all we're doing is giving them more insulin, we're not addressing the cause of the problem. And again, going back to how can we do this without just giving our patients another prescription? Because I can tell you, as someone who works in a clinic all the time, patients don't want just another prescription. They want an answer. They want to be empowered. They want something that they can control. And so we go back to that initial graph. What's going to keep their insulin levels low? Not what we've been telling them to eat. So, in walks the Verta approach. We're going to take a different approach to bring their blood sugars down. We're going to do it by understanding the nutrition science first and changing what they're eating. Now, how do we do this to scale? How can we get people to do this and be successful? Because let's face something. If you're going to make a lifestyle change, the one thing I can tell you is it's hard. If it was easy, everybody would do it. Patients need multiple things in order to be successful. So let's talk about how we handle that. First, let's get the science right. And instead of going towards this vicious cycle of progression, Verta, by changing what people are consuming, is going to turn that cycle completely backwards. And one other important point before we go into the technology aspect of this is people say, well, if you're reducing carbohydrates, how are you going to have any energy? Because you need those for energy, right? Well, only if you're eating carbohydrates. But actually, we have this great source of energy from fat, and it's called ketone bodies. So we can use both the fat that we consume and the fat that we eat, the fat that we have stored, to make something called ketone bodies. Ketone bodies are a great source of energy. In fact, what newer research is showing us is that ketone bodies are actually the preferred source of energy by some really important organs in our body, like our brain and our heart. So our patients get plenty of energy from a different source. They are fat burners. So, getting the science right, critical to treating this disease, and using technology. So here are our founders. Oops, I don't think it pulled up the picture. Okay, well, anyway, the pictures are supposed to be up here. Two of the lead researchers in this field who have together published hundreds of papers, and Sami Ikonen, who actually uses technology to solve problems. He was actually the founder of Trulia, which was sold to Zillow. And the reason that he is interested in this space now, having come from real estate, is that he won the Ironman in his age group. The year he did that, he was diagnosed with prediabetes. And so if we go back to our standard of care, and he said, eat less, exercise more, I have 8% body fat. I've been restricting for 20 years, and I just won the Ironman. How can I eat less and exercise more? There has to be another answer. So Verta's answer is to stop counting calories, which is a huge relief to patients, eat real food that is delicious and satisfying, and not push people to exercise until they're ready. And To do this in primary care, I was a primary care doctor for years, to sit down and tell patients how to change their lifestyle and give them the support that they need in a 10-minute office visit isn't gonna work. What we have is a care gap here because primary care doesn't have time, and endocrine, there's not enough of those, and even there, having the time to teach people is very challenging. So what does Verta do? Here is a patient, and we have 5 pillars to make this work for people on an individualized and personalized basis. So our patients who join Verta are tracking their biomarkers. By that I mean blood sugar and ketones and weight. They are getting input all the time, daily, 24/7 access to their personalized health coach. And there's a physician at the other end too. So each patient who comes into Verta gets their own health coach and their own physician. Because when you're dealing with patients with type 2 diabetes who are on multiple medications, you have to make sure you do the de-prescribing properly so that you can keep patients safe as they're embarking on a lifestyle change. And there's resources. So patients get lectures, they get interactive group sessions all through their phone. So it's literally putting the clinic, full service clinic, in their pocket. So we can take down a lot of the barriers in a brick and mortar setting. And then there's other patients. So we have patient communities. So they can not only get the support from their doctors, their health coaches, but from each other. And this is all happening on their phone. So again, the personalization that this, The personalization that this is able to provide is key here for people. Because you might have someone who joins the Verta program who travels for a living and does most of their eating in an airport. And then you might have a stay-at-home mom who has an organic garden. And if you're trying to give them the exact same advice, you're gonna fall short. So using technology allows us to individualize and really personalize the advice to that patient. So going back now to our standard of care versus the Verta approach to diabetes reversal. Instead of medications up, we want to take them down. Our patients, as we're going to see here in our trial, lose a significant amount of weight. When you're taking less medicine, guess what? It costs less. No calorie counting, and exercise is optional when the patient is ready. And so let's talk a little bit about our clinical trial. So we have almost 400 patients in our clinical trial in the treatment arm. 262 of them have type 2 diabetes, and the remainder have pre-diabetes. So we're trying to look at this in both populations. This is in central Indiana, so this trial is happening here. And the average BMI in patients starting our trial is over 40, which puts them in the morbidly obese category. So what happened after just 10 weeks? So we can take a look here at medication reduction, because what we are doing in our trial is 2 things that have thought to be impossible to occur at the same time. We're improving their blood sugar and we're getting rid of their medicines. So what about insulin? So the dark blue, those are insulin patients on insulin who had their medication, the insulin completely removed after 10 weeks. The bar above it is patients who had that medicine reduced in that 10-week period. And we can see this for other classes of medications too. Sulfonylureas, 90% of patients who came into the trial on those had those completely eliminated in the first 10 weeks. And it goes on to all the other classes of diabetes medication, with the exception of the far right, which is metformin. So metformin is a medication that is incredibly low cost and is also used for pre-diabetes, so it's the only one that we discouraged our patients to remove. Every other class of medications we're working on getting patients off of. So, were they able to bring their blood sugars down despite the fact that they were taking less medication? And the answer is by a lot. So the average reduction was 1% in their A1C. I mean, if there was a drug that we were putting on the market that had an A1C reduction of 1% in 10 weeks, it'd be big blockbuster. But this was happening again while they were taking less medicine. And how about weight loss? Were they losing weight? In 10 weeks, the average weight loss was over 7%. And how about other factors? So this is just one. We also had a significant reduction in triglycerides. I mean, I'm actually a board-certified lipidologist too, and the one thing that I'll tell patients is there's no medicine in the world that can lower triglycerides quite like a low-carb, high-fat diet. And we're not the first ones to find this out. So there is a body of literature that supports this in the past that we are adding to. And so we can see here 2 trials. This first one went out on the left to 56 weeks. And the bright blue on the graph is patients who began the trial with type 2 diabetes. And the red is patients who were entered into the same treatment, low-carb, high-fat diet, who didn't have diabetes. And what you see is that by the end of the 56-week period, from a blood sugar standpoint, they matched. In other words, the patients who started the trial with diabetes at the end of the trial matched their non-diabetic counterparts in their blood sugar. And on the right, this was a quick trial, so 56 weeks on the left, on the right, 7 days. So what happens if you take a patient who has type 2 diabetes? Can you improve things in only 7 days? Absolutely. What happens if you take away the carbohydrates and increase the fat? Guess what? The blood sugar goes down and the insulin levels go down, and it goes down fast. Again, this is another study looking at a low carbohydrate diet versus a low glycemic index diet, which we hear a lot about. And guess what? The low carbohydrate diet patients not only were able to get rid of a heck of a lot more medications, but they had much better blood sugar improvements. It works. How about weight? Same thing. Looking at, skip ahead to slide, this was just published here. This is a trial looking at, same thing, ADA treatment versus a low carbohydrate treatment in patients with type 2 diabetes. And in 32 weeks, what we see is significant improvement, more medication reduction, and more improvement in glycemic control in the patients on the low carbohydrate group. And so really quickly, history and safety of ketosis, which we talked about earlier, is the energy our patients are using. This actually began 100 years ago. This was the standard of care treatment before we had all the medications. And again, going back to, did we have all this evidence around to change our recommendations for patients to say, restrict fat like crazy, which aggravates the problem? This is a study that, came out last year that said, actually the evidence for that recommendation that stuck with us for so many decades did not exist. So, is there anyone in the world doing this? And what happens? We can actually find some interesting cultures who live this way on a regular basis. And what you find is a complete absence of cardiovascular disease, cancer, and definitely diabetes. It's pretty remarkable, the health of these people. How about athletes? Can they do this? So the interesting thing is in the world of athletics now, carbohydrate-restricted athletes are winning. They're winning because they're using stored fat as energy. So it's pretty remarkable, even outside of the realm of diabetes, what we're seeing. And one thing that also gets brought up sometimes is people say, oh my gosh, ketones, ketosis, sounds like ketoacidosis. And so I put this graph up here to show you nutritional ketosis, which is what our patients are in when we restrict their carbohydrates, is a far cry away from ketoacidosis, which we know is a deadly condition that type 1 diabetics can get. And again, our primary care referring physicians to Verta are thrilled with this because we take away something that really takes time from the office. So what does a day in the life of a patient who's following the Verta program look like? First of all, it looks like success in retention because at 10 weeks we had over 90% of our patients still active in the program. Very important fact. And so in the morning when they get up, they're gonna step on their Verta scale, which is gonna populate into the app. And their health coach is gonna be able to see that every day. They're gonna go and enter in their blood glucose, their ketones. And so when they eat something that may have brought their blood sugars down, they can get some immediate feedback from their coach. Hey, what was dinner last night? Because your blood sugar looks awesome. So they don't have to wait 3 months till they come in and they have no idea what went well and what went wrong. They're getting immediate feedback right now, personalized feedback. And what are they eating? Is it miserable? No. Actually, the one interesting thing when people bring fat back in their diet, I always say is, the first thing that's gonna happen when you start eating fat, you will be happy because fat tastes great. And we have completely lost sight of this in this concept in our irrational fear of it for so many decades. So again, patients are going to be communicating with that health coach that's assigned to them on a pretty regular basis. In fact, at the beginning of the Verta program, we find that coach-patient interaction occurs almost 3 times a day. It can be anything from, hey, I'm going to a party this weekend, what should I bring? To, oh my goodness, they carried in pizza for dinner, what do? I need help right now. And as patients are beginning to make lifestyle changes, those little day-to-day things and being able to help them is key. More food. Guess what? It's still delicious. And again, remember what I said? They're not a slave to calorie counting. So we're paying attention to carbohydrates, but our patients are counseled to eat when they're hungry and don't eat when they're not. Here, a day in the life, a patient might have a moment in between, clients at work or while they're waiting for a kid to pick up from softball practice. And they take time to watch one of the instructional videos to get some of the core concepts down. And again, more pictures of food because we like to teach our patients to eat. And yes, you can do it also if you're eating out. That's one of the other keys with the health coach. We're going out to eat at such and such a place. I don't have time to cook tonight. What can I pick up on the run? We can communicate that to patients and help them. So how carbohydrate restricted are our patients? Well, initially when our patients come in with type 2 diabetes, we restrict them down to about 30 grams a day. And that changes over time for most people, but 30 grams a day sounds really restricted. But that's what it looks like. It's actually a huge choice of foods for patients. So again, this is another one of the videos that our patients might watch while they're preparing maybe a dessert that they could have, because they can still have that too. And they connect with their patient community. So they're not only getting advice from their health coaches, they may find out on our community page what somebody else was able to do, a solution someone else was able to develop. And again, eating whole foods is key. So a new paradigm. As we go forth, trying to figure out what we are going to do about this problem, because we can't sit and take a back seat any longer. Type 2 diabetes is growing at alarming rates. We can't afford this financially any longer, and our patients can't afford what it's doing to their quality of life any longer. We must change the dialogue from management of this disease to reversal, so that patients understand that that's possible. We have to think about things that make sense. No calorie counting. Most people can say, I can do that. Eating delicious real foods and not pushing people all the time to just eat less and exercise more. Remembering there's 5 pillars to making this personalized, individualized for our patients, because just telling them to restrict carbohydrates alone won't work. They need much more support than that. So Verta, a new paradigm bringing solutions to a terrible disease. Thank you very much.